Hi, I'm Chandler.
And I'm Renee.
I'm Karina.
And I'm Caitlin.
And for our assessment tool, we have the Jebsen hand function test, which is a test that was designed to assess the fine and gross motor skills in the hand function for your dominant and non-dominant hand. It was originally designed for individuals who are suffering from spinal cord injuries, but today it is also used for individuals suffering from neurological or musculoskeletal injuries. It can be used on patients ages 6 and up. So, for example, a 6-year-old who's suffering from spinal cord injury, an 18-year-old who suffered from traumatic brain injury, or even a 60-year-old who is suffering from a stroke. It can be purchased at a place called Allegro Medical for $390.
The Jebsen hand function test is a 7-part test that determines the level of hand function. You will need to test the non-dominant hand first, followed by the dominant hand. There are several different tests that the Jebsen hand function test includes, which are writing, page turning, picking up small objects, beating, stacking, picking up light objects, and picking up heavy objects. You will need a pen and 4 unruled sheets of paper, 5 3x5 index cards, an empty coffee can with 2 paper clips, 2 bottle caps with 2 pennies, 5 kidney beans with a teaspoon, 4 checkers, 5 1-pound empty cans, and 5 full 1-pound cans.
When you go to perform the assessment, you will find a piece of paper that looks like this, which is just an overview of what the norms are for the certain age groups in both males and females. And you'll also find a piece of paper that looks like this, and this is just used to record the data once you've performed the assessments.
Now, Renee and Karina are going to demonstrate how to use the test.
As Caitlin said earlier, this test consists of 7 parts. As a group, we chose to do the card turning, and so what you're going to do is you're going to place your non-dominant hand on the table, and you're going to turn the cards. And as Karina turns the cards, then I will time her and see if she has a deficiency or she is within the norms. Hey, Karina, how are you?
Hi, good.
I'm Renee. I'm your occupational therapy student from Middle Georgia, and I have a couple of tests that we need to do this afternoon, and we're going to try to get you back to, I know you have been having some troubles with some of your ADLs, so we're going to try to get you back to being able to do some of those that are important to you, okay? All right. As we start with the card turning, Karina is going to place her non-dominant hand on the table, and as she places her non-dominant hand on the table, she is going to turn the cards. As she turns the cards, I will time her, and then we're going to see how she measures up to normal or if she doesn't meet the normal or if she has a deficiency. Okay? I'm going to let you start with your non-dominant hand. So whenever you get ready, I'll let you just turn the cards, and I'm going to time you. So, you ready?
Mm-hmm.
Okay. Go ahead and start, and we'll turn the cards. Ready, set, go. Okay, now let me record your time here. All right. Now what we're going to do is you're going to do your dominant hand. So as you do your dominant hand, just place your dominant hand on the table. Okay, and you're going to turn your cards from the furthest end. All right, whenever you're ready. All right, go ahead and begin turning the cards. All right. As 20-year-olds, this was 4.8 seconds with your non-dominant hand, and with your dominant hand, it would be 4.3 seconds. Your test finds that in your non-dominant hand, you had 5.7 seconds, and then with your dominant hand, it was 5.11. So there is a small deficiency, but there are some things that we could work on with your ADLs.
Okay, and since I was below the norms, I would have difficulties doing things like putting on my socks or pulling up my pants, folding clothes. A kid in school would have difficulties opening or closing his binder or erasing with a pencil.
And that concludes the Jebsen hand test.
Bye.
Bye-bye.